We discussed the major bones that compose our cranium, but there are also a number of individual features associated with each bone that allow for the passage of nerves or blood vessels or serve as muscle attachment sites, for example. So again, starting from the superior aspect on our frontal bone, just superior to our eye orbit, there will be a foramen or an opening for what's called the supraorbital nerve. And this is a branch of our cranial nerve number 5, trigeminal, and its first division, the ophthalmic. So that nerve will emerge onto the face there and provide innervation to the scalp, sort of down inferior to the bridge of the nose. Continuing inferiorly onto our maxillary bone, we'll see another foramen called the infra-orbital foramen. And through this passes the infra-orbital nerve, which is associated with the second division of our cranial nerve 5 trigeminal, the maxillary division. So continuing inferiorly to the mandible, we have our third large opening called the mental foramen. And this is where the mental nerve, which is a branch of our third division of trigeminal, the mandibular nerve, emerges onto the lower face. There are many other foramen fissures, openings associated with the eye orbit that take nerves to our eyeball, to our extraocular muscles, and we're going to talk about those when we discuss the cranial nerves. But one that we can see or appreciate sort of posterior in the orbit is this fissure. It's sort of a slit that goes superior to inferior. It's called the superior orbital fissure, and that's a really important landmark that we're going to discuss, particularly for those cranial nerves that innervate the extraocular muscles. If we flip our cranium to the lateral aspect, I want to draw your attention again to our zygomatic and our temporal bones. So we have the zygomatic arch that's formed from the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. So together, those are the zygomatic arch. Okay? This sort of depression is the temporal fossa, and within this region, we'll find our temporalis muscle, which is one of the muscles of mastication. And if you actually clench your own jaw and put your hand on the lateral aspect of your face, you'll feel temporalis tense. Okay? Another important feature on the temporal bone is our mastoid process. So it's a large projection. It's sort of a bump of bone just behind your ear, so you can feel this or palpate this on yourself. And it serves as the muscle attachment site for our sternocleidomastoid muscle. This also is a sexually dimorphic feature, so we tend to see larger mastoid processes in males, for example, versus females, but of course this can be population specific. Okay. Continuing posteriorly to our occipital bone, okay, remember this is large unpaired, we have this sort of hook-like structure called the Nuchal Crest, okay, and this serves as a muscle attachment site for a number of our muscles in our back externally and superficially, like trapezius, for example, as well as some of the other strap muscles. So you can see that here. This is another sexually dimorphic feature. Okay. Switching gears to the superior aspect of the cranium, I want to demonstrate where our sutures reside and the bones that they're associated with. So again, this is going to be anterior, the frontal. This is going to be posterior, okay? And then this is the superior view here with your two parietal bones, okay? So separating our frontal from our two parietals is a coronal suture. And remember, this is going to follow the plane. So your coronal plane is going to divide your body into anterior and posterior halves. The parietal bones are separated by the sagittal suture. And again, that follows the sagittal plane. That's going to separate your body into left and right halves. Posteriorly, we have what's called the lambdoidal suture that's going to separate your occipital bone from your two parietals. Okay? And laterally, there'll be the squamosal suture that separates your temporal from your parietal, from your frontal, and some other smaller bones. Okay? And remember that these are fibrous joints. Fibrous joints are not easily movable, okay? Especially after growth and development.